Moving on to other stories now, in the Northeast, the Development Commission has commenced training of doctors and nurses in Taraba State on basic emergency care. Participants were drawn from tertiary health facilities and are expected to step down the training to other emergency health workers at secondary and primary health facilities in the state. Olabi Adenusi filed in this report.
Emergency situation is a regular occurrence in the northeast region of the country due to the activities of the insurgents, natural disaster, and communal conflict in the region. Lives that could have been saved are usually lost due to lack of skilled health workers during emergencies at the primary and secondary health facilities around the people. Worried by the ugly trend, the Northeast Development Commission is collaborating with some development partners. In this all are doctors and nurses from tertiary health facilities in Taraba State, selected to be equipped with emergency response skill.
The idea behind the initiative was to see how to improve frontline healthcare workers, especially those at the pre-hospital care as well as in the hospital care, in management of emergency care, for them to be able to respond to what acutely ill patient that is in a critical condition, to be able to stabilize the patient. That was the idea, because we realized that over time in the northeastern part of the country, there are many emergencies that just a simple procedure would have been able to what.
In his address, the Chief Medical Director, Federal Medical Center Jalingo, acknowledged the input of the NEDC on health intervention in the Northeast and lauded the Commission for adding emergency health response training for health workers to the list.
Northeast Development Commission, we thank you so much for sponsoring this, and we're happy for what you've been doing so far in terms of actualizing your mandate of caring for people of the Northeast.
Taraba State Coordinator of NEDC, as well as the Federal Ministry of Health, promised to sustain their partnership with the state government and relevant agencies to ensure more health workers across the state benefit from the exercise.
It's part of our mandate in Northeast Development Commission to improve the healthcare services in the region, because we have left behind. So starting with this today, I am assuring you by the special grace of God, the NEDC will do more.
Participants also expressed willingness to step down the skill acquired to other health workers in their various facilities after the exercise.
At the end of this program, I want to learn basic emergency care in order to help and attend to my patient accordingly.
At the end of the training, it is expected that more lives will be saved and gap in emergency response at secondary and primary health facilities will have been bridged in order to reduce pressure on tertiary health centers.